This training program will help you to understand how our washroom surfaces become contaminated and what steps you can take to minimise cross-contamination and keep your washroom surfaces hygienically clean. What common bugs are present and how did they get there? The washroom is a biological waste transfer station where human waste and bodily fluids are transferred from the human body into the sewerage system. During this process, some traces of waste and bodily fluids escape from the porcelain slide and end up landing on nearby surfaces. When you think about it, it is possible that someone else may not clean up after their business as well as you do. They may only use a few pieces of one-ply toilet paper and end up with a slightly moist hand. This hand is then used to flush the toilet or urinal, open the cubicle door, turn on the tap, touch the soap dispenser, the paper dispenser, or they may simply shake their hands dry. Then, as a last-ditched effort to infect you, they will leave their moist prints on the door handle as they leave. As you can imagine, with all these surfaces contaminated and with less than 10% of people actually washing and drying their hands properly, or even washing their hands at all, the washroom actually becomes a biohazard. And this is where most people pick up some of their new infections. This biological incubation station is home to many bacteria, viruses and fungi, commonly known as germs. Most germs are relatively harmless. However, some can cause sickness, disease and even death, and these germs are called pathogens. They are usually picked up on the hands from coming into contact with moist infected surfaces, and they usually enter the human body when your hands come into contact with your mouth, nose, eyes and ears. What bugs are they and what can they do? Common germs found in washrooms are Pseudomonas, E. coli, Streptococcus and Staph, and you can nearly always have a good chance at being exposed to these pathogens, which could lead to a range of infections, including gastrointestinal, skin, and ear, nose and throat infections. In a healthcare facility, the number of germs present in a washroom setting is multiplied many times, as the facility has a larger number of infected patients using the washroom more often. Today our facilities are not faced just with bugs, but with superbugs that are resistant to many disinfectants and antibiotics. Not only are these patients already sick, but they could easily pick up a new infection that has been carried to their washroom or bedroom via the cleaning process. These are called hospital-acquired infections, and they are responsible for many sicknesses, longer stays and even deaths. In a school washroom, these problems are magnified as most young children have immature immune systems, low understanding of hygiene and spend more time exploring the world and their bodies with their hands. Hand washing. These germs can often live for many hours in moist, warm environments, and the bad odours you can smell in the washroom are evidence that the bugs are alive and breeding. In today's busy world, most people think that as long as they have wet their hands under the tap and shaken them dry, that their hands are clean. They may look clean. However, if you've picked up some germs from already contaminated surfaces, then wetting them will only help them stay alive longer and increase the chances of them multiplying and making their way into your body. As most washroom surfaces are contaminated due to poor hand washing and hygiene routines, you can only protect yourself through thorough hand washing and drying, and by eliminating contact with these surfaces. Did you know that the process of simply putting disposable gloves on will infect them if you have not washed and dried your hands effectively prior to putting on the gloves? You should always wash your hands after going to the toilet, before preparing, touching or eating food, after touching animals, handling money, or coughing, sneezing or even blowing your nose. For cleaning staff, hands or gloves should be sanitised at regular intervals, before moving on to the next area to be cleaned, before and after putting on and removing gloves, before picking up a new cloth after disposing of a used one.